Have you been feeling more tired than usual lately? Do you climb a few stairs and feel your heart pounding harder than it should? Many people think a weak heart is obvious, but the truth is, the symptoms can be so subtle that they go unnoticed for years. Today, I'm going to show you how to know if your heart is weak without going to the doctor, and what warning signs may be trying to alert you before it's too late. Your heart doesn't scream when it's in danger, it whispers. And if you learn to listen to those whispers, you can detect what thousands discover too late. Sometimes, the body warns you with simple signs, fatigue, swelling, or palpitations that most people confuse with stress or normal exhaustion. Every year, more than 17 million people die from heart disease, and many of them never experience chest pain. The real enemy isn't always a sudden heart attack, but the silent wear and tear that weakens the heart day after day, without you noticing. What you're about to hear can literally change the way you understand your body. Your heart beats more than 100,000 times a day, asking for nothing in return. But over time, stress, poor diet, lack of sleep, or even your sleeping position can make it start to fail, silently. There's not always pain. There's not always a clear warning. But the body always speaks, you just need to learn how to listen. Think about it for a second, your heart has worked non-stop since before you were born. It never stops, never complains, never takes a vacation. And yet, most people only think about it when something goes wrong. In the era of constant stress, the heart has become the silent victim of modern life. We sleep less, eat faster, and live with chronic anxiety, three factors that weaken the heart muscle as much as disease itself. Every strong emotion, every sleepless night, every excess leaves an invisible mark on your heart. What's most surprising is that heart weakness doesn't start in the chest, it starts in your routine. The heart reflects your habits, how you breathe, how you sleep, how you handle stress. It's not just an organ, it's a mirror of your lifestyle. Studies show that chronic stress raises cortisol and adrenaline, hormones that increase blood pressure and heart rate. When this happens repeatedly, the heart stays in alert mode, accelerating its wear and tear. Even lack of sleep can disrupt circadian rhythms, preventing your heart from repairing itself at night. In short, the heart doesn't weaken overnight, it happens through small, silent habits repeated over time. Here are 7 signs that could indicate your heart is weak, even if your medical tests look normal. Unexplained fatigue. If you wake up tired or get exhausted from simple tasks, your heart may not be pumping blood efficiently. Swelling in your feet or ankles. When the heart can't circulate blood properly, fluid builds up in the lower limbs. Shortness of breath when lying down. If you need several pillows or feel you can't breathe at night, your heart may be overloaded. Palpitations or irregular heartbeats. They're not always caused by nerves or coffee, sometimes they mean your heart rhythm is out of control. Dizziness or fainting. A weak heart may not be sending enough blood to your brain. Cold hands or feet. Poor circulation is one of the first signs of low cardiac output. Difficulty concentrating or remembering. Lack of oxygen also affects your brain. If several of these signs sound familiar, your body is asking for help. A study published by the American Heart Association revealed that 40% of people who suffered heart failure had symptoms months earlier, but ignored them. The body always warns you, you just have to pay attention. Each of these signs is a silent message from your heart saying, I'm struggling to keep up. Many people confuse fatigue with lack of sleep or dizziness with low blood pressure. But in reality, these can be the first alarms that your heart is struggling to keep you alive. While you think you're just tired, your cardiovascular system may be working overtime. Heart disease doesn't appear suddenly, it builds slowly, day by day, through bad habits, processed foods, and poor rest. The problem is that when symptoms become noticeable, the damage has already been progressing for some time. That's why recognizing these signs can literally mean the difference between prevention and regret. Cardiologists explain that the body compensates for a weak heart through hidden mechanisms, retaining fluids, speeding up the pulse, or raising blood pressure. But this comes at a cost, organs become overloaded, the heart enlarges, and fatigue becomes constant. Often, these symptoms are mistaken for normal aging, but they're not. Listening to your body early can be the best preventive medicine there is. When the heart muscle weakens, it can't pump blood with enough force. This makes blood flow slower, causes fluid buildup, and reduces oxygen delivery to your organs. It's like driving with a worn-out engine, but you keep going, unaware. The most dangerous part is, it doesn't hurt. That's why thousands of people discover too late that their heart had been warning them in silence for years. Heart failure doesn't mean your heart has stopped, it means it's no longer pumping with full strength. Each beat becomes weaker, less efficient. And while your body tries to compensate by speeding up the heart rate or retaining fluid, that effort has a limit. Think of your heart as a water pump. When the pipes are clogged, the pump works harder and wears out faster. That's exactly what happens to your cardiovascular system when arteries are full of fat or you live under constant tension. The heart gets tired, and it does so quietly. The good news? This process can be reversed in its early stages. Changing habits, sleeping better, managing stress, and moving your body daily are small decisions that restore heart strength. Your body has an incredible ability to heal, if you give it the chance. Biologically, when you strengthen your heart through moderate physical activity and healthy eating, you increase the efficiency of your mitochondria, the tiny energy factories inside your heart cells. Reducing sodium and refined sugar also improves blood pressure and oxygen delivery. The heart can recover part of its function if you remove what's overloading it. Every small change counts, even something as simple as breathing slower or walking 20 minutes a day. Even the way you sleep can be a clue. If you wake up with palpitations, high blood pressure, or fatigue, your heart may not truly be resting at night. Sleeping in the wrong position, having sleep apnea, or lying down right after eating can make your heart work twice as hard. Sleeping well isn't a luxury, it's a cardiac necessity. Sleeping on your stomach or back can affect breathing, reduce oxygen, and force your heart to beat harder. That's why cardiologists recommend sleeping on your side, especially the left side, to promote blood flow and reduce pressure on the heart. Each night can either be an act of repair, or an act of wear and tear. Poor sleep quality can raise blood pressure, increase inflammation, and disrupt hormones. This doesn't just make you tired, it weakens your heart over time. A bad night's sleep can be as harmful as smoking or eating poorly. Sleep is the only time your heart can truly reduce its workload. If that rest doesn't happen, the damage adds up. So improving your posture, using a good pillow, and keeping a calm environment aren't luxuries, they're heart prevention strategies. Studies from the European Heart Journal show that people who sleep less than 6 hours per night have a 35% higher risk of developing heart failure. During deep sleep, the body releases healing hormones and slows the heart rate. If that stage is interrupted by noise, light, or poor posture, the heart can't enter recovery mode. Sleeping well is the most natural treatment to protect your cardiovascular system. Remember, the heart doesn't complain, it adapts, until it can't anymore. Listen to the signs, care for your rest, check your breathing, and don't ignore fatigue. Because a weak heart doesn't heal by luck, it strengthens through awareness. Share this video with someone who always says, "I'm just tired," because maybe their body is asking for more than rest. And tell me in the comments, which of these signs do you recognize in yourself? Your story could help someone else wake up in time. 80% of heart diseases can be prevented with lifestyle changes. You don't need medical equipment to start, just determination and consistency. What you do each night before sleeping may be more important than any medication. Your heart doesn't need big promises, just small daily actions: walk, breathe, sleep well, laugh more, worry less. Every beat you protect gives you more years of life. Caring for your heart means caring for your story, your memories, and the hugs you still have left to give. Sleeping well, eating healthy, and managing stress are acts of self-love. Don't wait until your body forces you to stop. Do it for yourself, do it for your heart. Every time you choose to take a deep breath instead of arguing, to walk instead of sitting, or to turn off your phone before bed, you're lowering your heart rate and protecting your future. Your heart doesn't need perfection, only attention. Remember, every decision counts, and what you do today can prevent the diagnosis that could change your life tomorrow.